There are concerns from local health officials about the number of tests that are available.
Also, questions about how the whole testing process happens from the moment someone thinks they are infected with coronavirus to the point when they're diagnosed. Reporter Joe Bruno started asking those questions and more, and he joins us now live tonight with some answers. Joe.
There are basically two different kinds of tests for coronavirus. One involves a swab up the nose. The other one goes to the back of the throat. The nasal one is more effective, doctors tell me. After those tests happen, oftentimes they'll be sent to a private lab like LabCorp, where there's a 3-day turnaround. Continued frustration from Governor Roy Cooper over the state's ability to test for COVID-19.
We did not receive the material that we were promised from the CDC, so we have begun working other avenues to do everything we can to make that happen.
The state lab has about 700 tests available. 900 are on back order. That 700 number is a big improvement. Wednesday, the state only had 250. The problem has been a lack of supplies that are used to extract genetic material to determine whether someone has coronavirus.
We are doing everything we possibly can to make sure that everyone who should get a test gets tested.
Fortunately, it is not just the state lab conducting the tests. North Carolina-based LabCorp has the ability to perform thousands of tests a day. That's where Dr. Ryan Shelton of Tryon Medical Partners sends his tests.
We do have plenty of tests, but it really needs to be reserved for folks for whom we have a higher index of suspicion to start with.
A sniffle and an earache isn't enough to get a test. Shelton says they are trying to save as many as possible for those who need them.
We're going to size up what are your symptoms, and then also what are your underlying risk factors, and then have you traveled.
Tryon Medical Partners is in the process of setting up a satellite location so people don't have to go to the medical office to get tested. Dr. Shelton is stressing that if you think you have any of the symptoms of coronavirus, that being a cough, fever, shortness of breath, wheezing, maybe even a sore throat, that you give the doctor's office a call ahead of time. Don't just show up saying that you have these symptoms of coronavirus. Really give them that call or do a virtual visit so you don't surprise the receptionist. Erica.
All right. Thank you, Joe.